more in today's Community Focus. A weight loss pill may no longer be a dream, but a reality, perhaps even by the end of the year. Joining me now to talk about that health headline and many more, Dr. Ashish Jha, the Dean of Brown University School of Public Health. Thanks for being here.
Thanks for having me here.
So before we talk about that weight loss pill, I want to ask you about sort of the shakeups we've been seeing down at the CDC. You worked for the White House previously, of course. Last month, the former director of the CDC testified she was fired because she refused to obey Health and Human Services Secretary Robert F. Kennedy Jr.'s demands. How concerned should people be about that and the current leadership at the CDC?
Yeah, it's a great question. I am concerned, and let me explain why.
Okay.
There's some really critical things that CDC does. When there's a food illness outbreak, right? CDC goes and investigates. If there's an Ebola outbreak in Africa, how do we make sure it doesn't end up in the United States? CDC goes and does that. Which vaccines should your kids be getting? CDC does that. What we're seeing is a dismantling of all of that, and I'm worried about what kind of impact that is going to have on the health of the American people.
Are you concerned already with some of the directives and narratives coming out of Washington in terms of health and how people approach their health care?
Well, certainly on vaccines, there's been a lot of bad information coming out of Washington, and that's why you're seeing states, including Rhode Island, Massachusetts, saying we're going to come up with our own recommendations. We're not going to follow CDC guidance. That's not great, but they have to do that. We're going to have to watch this, and when I think Washington makes a mistake, we're going to have to call them out on it.
Let's talk about that weight loss pill that I mentioned at the top. You know, I think for decades, people have been searching for a pill that actually works when it comes to losing weight. Eli Lilly now claims that they have made this drug. Of course, we've already seen the popularity of these weight loss injections, these GLP-1s. What's your take on this pill, and what should people know about when it might be available?
Yeah, it's a great question. So first of all, let's talk about the evidence. The GLP-1s like Ozempic, they work really well, and they help you lose a lot of weight. But you have to inject it once a week, which is, for a lot of people, not very convenient. This is just an oral version of that. It doesn't work quite as well as injectables, but it looks like it's pretty well tolerated. My guess is, as you said, that it will be available probably by the end of this year or sometime early in 2026. Once it becomes more widely available, I suspect a lot of Americans who've been on the sidelines waiting will want to jump in and try it out.
We will wait and see how that works out. Speaking of those GLP-1s, we know that they're not only used for weight loss, but to treat diabetes as well. And now we're hearing some evidence that they might be helpful for addiction too. Yeah,
so what's really interesting about these drugs, and again, we're talking about drugs like Ozempic, is that they help reduce cravings, which is why people eat less. Well, that also helps with cravings for alcohol, cravings for opioids. The data there, Kim, is not quite as good as it is for weight loss. The data on weight loss is terrific. There's some early studies that say it might help on those things. I think we're going to know more. So I'm not yet prescribing it for those things, but there's enough suggestive evidence that I think it may pan out.
And speaking of shots, I hate to say that we're approaching cold and flu season, but we are. What do you recommend for folks at home in terms of what shots to get, what age groups, et cetera, should be getting those shots?
Yeah, absolutely. So I'll start off with what I'm recommending my own family.
Okay.
I have elderly parents. They're going to get the COVID shot and they're going to get the flu shot, and it's non-negotiable as far as I'm concerned. And they're pretty good about listening to me. I have kids, teenagers. What I have said to them is, COVID shot is very much your call. If you want to get it, you can. I don't think it's critical, but the flu shot is important for everyone. I'm in my 50s. My wife is in her 50s. We both decided that it's good for us to get COVID shots and flu shots this winter. Look, a simple way to think about it. Flu shots for everybody, COVID shots for people who are older or who have chronic diseases. It's really important.
Important advice. Dr. Ashish Jha, thanks so much for being here at 4.
Thank you.
And looking ahead to later this week, when Helena Folks will join us live in studio to talk about her candidacy for governor. That's coming up on Wednesday at 4.